Take it away.
Hi, my name is Lauren. I'm a licensed practical nurse and a pharmacy technologist, and I want to talk about biotherapy. Everybody's familiar with going to the hospital or going to the doctor's office, getting a shot, taking medicine, or having to endure treatment of some sort. Biotherapy is an alternative to that. By definition, it is the use of living organisms to diagnose and or treat illnesses. It encompasses the use of anything from larvae to bees to maggots, leeches to dogs. Examples of biotherapy are the bee sting therapy, which is used to treat neurological disorders, multiple sclerosis, and arthritis. You can do anything from ingest bee venom or to having the bees put on your body in certain points to sting you in order to take out the inflammation of arthritis. Another great example are leeches. Historically, and in the 19th century, they were used as an alternative to bloodletting. Bloodletting was the practice of cutting you open to let you bleed out the poison that was in your body. And a lot of people died, from blood loss during that process, so the leeches were a good alternative to that. Now, leeches are used in modern day to help bring back circulation to limbs and to clogged veins and arteries. Another example are maggots, and that's my personal favorite. Maggots are used, they've been used throughout history, from the Mayan Indians to the Australian Aborigines to the most famous, the Civil War, where doctors in the battlefield recorded the use of maggots and how they kept wounds clean and saved people's lives. My grandfather is a good example of the use of maggots, where he was inadvertently given maggot therapy on a battlefield hospital in France. He was shot in the shoulder, and in the hospital, the conditions were sparse, not that sanitary, and he actually developed maggots in his wound, and later on he was told by doctors that those maggots in his wound saved his life. Other sources of biotherapy are fish, which are used to treat psoriasis, and dogs, which are used to detect cancer in undiagnosed patients. And dogs can also detect oncoming seizures in patients, and they're also used to help patients cope with illnesses and make them happy, and happy patients generally are healthier patients. Modern use of biotherapy is coming back. Biotherapy traditionally was used as treatment in olden times and prehistoric times, but now, knowing the uses of what biotherapy is it's natural, it works with the body, and it's cleaner and it's greener. It's better for the environment. It cuts down on pharmaceuticals, it cuts down on waste at hospitals. And if you can use a dog to detect cancer or an oncoming seizure, you wouldn't have to use as many tests, and you would have earlier detection. By putting 5 to 10 maggots in 1 square centimeter of a wound that has a gangrenous infection, which has killed a lot of people, and just letting them be in there under breathable material for 2 to 3 days, they completely clean out the wound by liquefying the rancid flesh and sucking up the juice of rancid flesh with bacteria in it. Those maggots have saved lives and will save lives. I think that biotherapy in modern terms is coming back bigger and better than ever, because doctors now know why biotherapy works. It's not just an old wives' tale anymore. I enjoy the research on biotherapy because it saved my grandfather's life in a troubled time, and because getting back to nature is the best way to be healthy and treat illnesses and diseases. Thank you. Are there any questions? Okay, thank you.
Okay.
I don't know.